Ladies and gentlemen, it's another edition on Time with a Gynae. This is Dr. KK. I'm coming your way today with something very interesting, and I hope you will enjoy it. If this is your first time on this channel, please subscribe to the channel, share for others to also enjoy. Today, I'm going to talk to you about your menses. So, what is menses? Every woman menstruates at a point in your life. So for all women who are in their reproductive age, it usually starts from about 15 years for a lot of people. You start seeing some blood, and that is what is termed as your menses, and it comes every month. So there are instances where you see some changes, some differences. Some of the months, the days are reduced. Sometimes it goes more than normal, more than you expect. Some of the times it doesn't come at the appropriate time you expected it to come. And sometimes you're wondering, is this normal? Some months you don't even get your menses at all, and you are so confused. What is happening to me? Stay tuned and enjoy these episodes. I'm going to educate you on your menses. So menses is a normal part of any reproductive age woman, which comes every month. And this is why that happens. The womb of a woman goes through some changes every month. And at the end of those changes, it comes as menses. And this is what's happening. Every month, your womb undergoes some changes in preparation for a pregnancy. And that is normal. That is natural. That's how God made it. So that your womb is ready if you happen to be pregnant. So at the end of the month, if you don't get pregnant, the inner lining of your womb sloughs off and it comes out as blood in addition to the egg that was not fertilized in that cycle. And that's what comes out as the menstrual flow. Now, every month you realize that you see it. Some people get some symptoms before the menses starts, and that may be normal. There are the extremes which will need some treatment, which is usually termed as abnormal. But for most people, you experience some symptoms like weakness, loss of appetite, loss of interest in a lot of things. There are actually some people who actually get mood changes, mood swings when it's about time for them to menstruate. And all those things, they are not too unusual. But I'll tell you what is normal when it comes to your menses in terms of the flow, the quantity, the number of days, and what you are supposed to feel, what you're expecting. And I'll also tell you what is abnormal so that at the end of the day, you are well informed and all others are also well informed. So, menses, how many days? What is normal when it comes to the number of days? The number of days that is normal is between 2 to 7 days. 2 to 7 days. So for some people, you will only see blood for 2 days. Some will see 3 days, 4 days, 5 days, 6 days, or 7 days. Now, understand that it is not abnormal if your menses comes for 3 days, if your menses comes for 2 days. One thing is that for the time you started menstruating, you may have been seeing your menses on every month, 5 days. The flow has been 5 days. And then for some particular months, you realize that it changes to maybe 3 or 4. And you're wondering, is it normal? Yes, it may be normal. It's normal actually because your menses is not stuck to 5 days. Sometimes it can go 6 days, sometimes it can go 4 days. So when you see that in terms of the quantity, in terms of the number of days, it is normal. What is not normal is when it goes outside 2 to 7. So for some people who menstruate for 10 days, 2 weeks, that is not normal. If you menstruate for one day, it is not normal. It's out of the normal. So for that, you will have to seek medical help, and then we'll be glad to assist you. Now, when it comes to the quantity, so a lot of people will be like, hey, this month, my menses, it didn't come well. Like, I didn't see a lot of blood. And sometimes I ask them, like, are you expecting to bleed to death when you're menstruating? So the quantity is actually 30 to 80 mils. That is normal, between 30 to 80 mils. And when you look at 30 mils, it's very small. So if for 4 days you are seeing some scanty bleeding, it is normal. And there are reasons why there may be changes happening to your cycle month by month. On another episode, I'm going to talk to you about why your menses may have changed in terms of the number of days. Maybe you were seeing 4 days, now you're seeing 5 days, you're seeing 3 days. On another episode, I'm going to tell you why that is happening to you. But when it comes to the quantity, it's 30 to 80 mils. So when you look at the sachet water is 500 mils. So imagine dividing that by 5, that is 100 mils. Your menses for the whole month should not even be up to that 1/5 of a full sachet water. So imagine your confusion. It is normal. What you're experiencing may be normal. All right. So take note of that. So, what if you don't have your menses for a particular month? Have you wondered why? Yes, some months you may not have your menses, and that may be normal. It may also be abnormal. All right. So if you don't have your menses for a particular month, it's ideal that you see your gynae for help. They will check if there's something unusual or if there's something abnormal. And if there's any help they can offer, they will offer that help. But most of the times, for 1 month of missing your menses, what we'll do is that we'll make sure that you're not pregnant. And that is usually the commonest cause of somebody missing their menses, pregnancy. So once we rule out a pregnancy and we look at the other possible causes and it's not any of them, may not do anything about it. May not do anything about it. There may be reasons why your menses may have not appeared on that month. One of the things that could be the cause is stress, change of environment. Anything that may have changed in your life can actually influence your menses. And that can actually influence the number of days your menses may be coming, or even a particular month for you missing your menses. So do not be too alarmed if your menses did not come for that month. All our advice is that you seek for medical help, and then that is found out. The cause is determined for you so that you are clear in your mind. Right. So now, menses, what is it? I hear on the radio sometimes some people say, oh, if you don't menstruate for a particular month, or even the commonest thing is that if you're on contraceptives, and you don't menstruate, they tell you that that blood is staying in your body. It's dirty blood that is staying in your body, so you have to get rid of it. Come and let's give you some medicine to get rid of that dirty blood, please. If you don't menstruate for a particular month because you're on contraceptives, that blood is not staying in you. That blood is not the reason why you did not get your menses is how the contraceptive is working. That is the reason why your menses didn't come. So it doesn't necessarily mean that the blood is staying in you. If you don't get your menses for a particular month, it is not an indication that you have dirty blood stuck in you, so you have to come for help. That is absolutely untrue and is false. Please take note, do not be deceived. Menses is normal for every young lady or every woman throughout your reproductive ages. So when you get it for a particular month, it is good. It's a good thing that your system is actually working. If you don't get it for a particular month, there may be a cause for it. And I've cited an example as stress, change of environment. For some students that you usually see, it's probably because exam is coming up and they are too stressed because of the exam, so their menses may not come for that particular month. So take note. These are the few things I want to tell you for this episode on menses. I'll give you more details on other episodes when it comes to your menses. Enjoy all the episodes I'm going to give you on this menses series. Once again, it's time with the gynae. I'm Dr. KK. I'll see you in the next edition.